Betty Namirimu is a mother of two living in Kampala. During the delivery of her second child, she experienced a severe attack known as a sickle cell crisis. She says the pain was more intense than her contractions.
I can't explain that pain because labor pain is so painful. But sickle cell pain is so painful than labor pain. Now, if you had sickle cell pain and labor pain, it was worse.
That experience haunted her for quite a while and made her fear getting pregnant again. She resorted to adopting a family planning method. Medical workers manage the sickle cell crisis by offering patients a number of pills that are supposed to be taken on a regular basis. Namirimo was concerned about the pill burden in her sickle cell crisis and did not want to add another pill as a form of family planning. She wanted advice.
But the challenge is when these patients go to the family planning clinics and declare their status, they have sickle cell disease, most health workers will chase them out because they are not sure what can we give them. In their training, probably they don't go into that much detail of getting to know what is best for them.
The solution will be to sensitize our health workers about sickle cell clients and how to manage sickle cell clients, because people tend to refer them fearing that we will not manage this, but it's not a complicated disease.
Namirimi's friend advised her to go to Mulago Hospital, where she was given a contraception called Injector Plan. The executive director of Sickle Cell Association of Uganda, Ruth Muchibi Nankanja, says Injector Plan is the best option for mothers with sickle cell anemia.
Why? Because one, in most cases it will stop their periods, and it will boost their hemoglobin levels, and it gives them good appetite. Naturally, sickle cell patients don't have good appetite. There are very few that have it. So it also boosts their immunity, because as it pushes the appetite high, then they are able to eat everything. So the immunity system goes high.
But Dr. Gerard Mutunji, the head of the non-communicable diseases at the Ministry of Health, says restricting sickle cell mothers to a particular method is not the best option.
The biggest problem for sickle cell clients is anemia, lack of blood. So if there is a method which can stop bleeding, it can have an additional advantage. But that's not the only consideration. There are other things you consider. And that's why I'm saying you sit with the client and you discuss all the family planning options available, and knowing that this is a sickler, you have to monitor that client more closely than you would to the other one. If there is any bleeding, if a sickler has bleeding, as you know, some family planning have a side effect of bleeding, then you need to either stop that family planning or give a blood transfusion or manage accordingly.
After 5 years of using family planning, Namirimo gained a lot of weight. She then experienced a condition known as hip necrosis, in which the bone tissue dies off due to lack of blood supply.
As long as you put on too much weight, of course, most of the weight will sit on the hips, and definitely it will damage it. So when one hip is damaged, you need like 18 million, and when both of them are damaged, how many people can raise that money?
She stopped the family planning method in order to save her other hip bone.
Probably they can stay on it for about 2 to 3 years because of the hip damage that I talked about.
Although she is not yet ready to give birth, Namirimu says she is still uncertain about which method to use. Sickle cell disease is a genetic blood disorder which affects a protein in the red blood cell that helps carry oxygen around the body. The Sickle Cell Clinic in Mulago Hospital has more than 10,000 clients. According to the data released last year in a research conducted by the US-based Cincinnati Children's Research Foundation and the Ministry of Health, indicate that 2% of all the babies born in Uganda have the sickle cell disease. Irene Namialo, NTV.